So this is what cerebral atrophy looks like on a brain image. It's a common feature of many of the diseases that affect us. Atrophy of any tissue means a loss in the size of the cell. So this can be due to progressive loss of key proteins. In brain tissue, atrophy describes a loss of neurons and the connections between them. Atrophy can be general or focal, meaning that the entire organ may be affected or only a certain part. So what causes cerebral atrophy? How do I avoid it? You can't. You're human, you're predisposed. But some of the major causes are stroke, traumatic brain injury, steroid use, Alzheimer's, cerebral palsy, senile dementia, Huntington's disease, multiple sclerosis, epilepsy, anorexia, type 2 diabetes, encephalitis, AIDS, all strong contributors to the advancement of cerebral atrophy. I personally subscribe to the use it or lose it mantra, and I try to constantly challenge my brain and work it out daily. On the CT portion of this slide, you can see the brain atrophy equally in both frontal and temporal lobes. You can see the way the brain is just shrinking away from the skull, and all that dark gray is cerebral spinal fluid just making up the space. So the brain is literally almost rattling around in this poor person's head. What kind of symptoms do you think that they might be exhibiting with this condition? Do you see anything else on this image that you have questions about? I'll give you a minute, or you can pause the video if you like to think about it. Don't stress, I'll show you.
So why was the patient demonstrating progress as the hemorrhagic transformation was occurring? Shouldn't his symptoms have gotten worse? I call these moments the calm before the storm. When I see a patient one day and they're fairly bad off, or even if they're the same as they have been for the last many days, and then I come in and all of a sudden they're better, I'm thinking, okay, what's happening? Like, this actually isn't a good thing, because as we know as therapists, like, progress doesn't just happen overnight like that. Something is going on. But the research also tells us that if stroke symptoms seem to be getting better before worsening again, this could be a sign of a stroke in evolution, where the affected area of the brain is still experiencing damage and could indicate a need for immediate medical attention. Even if symptoms temporarily improve, this is considered a medical emergency and you should seek prompt medical care. The size and location of the old infarct have left the patient with severe expressive aphasia and minimal progress. Why? I mean, it may be an obvious question. So, when we look at the overlap of the brain damage to the location of the language centers, it becomes clear why. Typically, when we get a patient, even with a left MCA infarct, it may hit Broca's, it may hit Wernicke's, it may hit the auditory cortex, but unfortunately for this gentleman, it took out all three centers. So it wiped out his language center altogether. And I think, looking at the size of the infarct, you can see that pretty clearly. So full frontal temporal, right across all three, as well as, the motor strip is in there. So we had that dense right hemiparesis. And this is why he had, pretty minimal expressive language, and he had yes/no reliability.